Good morning, everyone. Dan Bates, President and CEO, Greater Hamilton Chamber of Commerce, and we are happy you could join us this morning for Coffee and Conversations. This morning, we are very excited to have Stephen Roller, who is the President and Chief Executive Officer for Primary Health Solutions. And he's, you can see his PowerPoint up on the screen already. There's always exciting news coming out of primary health. They are definitely a leader in healthcare here in our area. So really excited to hear Stephen speak in just a few minutes. We are going to do, you know who I am. We're going to do self-introductions in just a minute, but let me tell you what the protocol is in case you haven't joined us before. We are on Zoom. We are also on Facebook Live. So if you are on Zoom, you can ask questions of the presenter just by raising your hand or interrupting him. He'll be fine with that, or hold them till the end. If you're on Facebook Live, you type your questions into Laura and she will repeat them to the speaker so we can get your questions answered for you. Once this is over today, this will be placed on our YouTube, so you can always watch it again later or share it with others that you think might be interested in this information. So with that being said, once again, Dan Bates, President and CEO, Greater Hamilton Chamber of Commerce, and we're going to go according to my screen with self-introductions. So if you would just introduce who you are and who you represent, and then we will turn it over to Stephen Roller in just a couple of minutes. So Sandy, you're first on my list.
Good morning, Sandy Kusnoff with Frames Glass. We're a full-service glass company. We do automobile, residential, and commercial glass.
Thank you. Benjamin. Can you hear me, Ben?
Yes.
Okay.
Can you hear me?
Yeah, we can now.
Okay. All right. Yeah, I'm downtown and there's a lot of construction going on in the building I'm in. So I apologize for my delayed response. But Ben Cornish, First Financial Bank, Community Outreach and Financial Wellness Specialist with First Financial Bank, which is a bank located downtown. Is where my office is, and we're a community bank that offer community solutions. Thank you.
Thank you, Ben. Zach.
Good morning, Zach Bohannon, Butler County Field Rep for Congressman Warren Davidson.
Elizabeth.
Good morning, everybody. Elizabeth Reisner. I am the Employment Services Coordinator for Butler County Board of Developmental Disabilities.
And Laura.
Hi, I'm Laura Merrill with the Greater Hamilton Chamber.
I think we got everyone. Did I miss anyone? If so, speak now or you're out of luck. Okay, we're going to get started. So Stephen, the floor is yours.
All right. Well, thanks, Dan. Thanks, Laura. Thank you for everybody for jumping on. Thank you for the opportunity just to talk a little bit about Primary Health Solutions, who we are, what we do. In particular, we're going to talk about one specific program towards kind of the back half of my presentation that really has made a significant impact for our patients in the community. But what I wanted to get started on was just to do kind of a 101 of who Primary Health Solutions is, what we do, what our mission and vision is, and kind of go from there. Because even just last week, I was meeting with a leader in the community and they said, hey, we wish we would have known about Primary Health Solutions because we've been in the community for a long time and I had no clue. And I think Dan probably hears that on a regular basis. And so we just want people to know who we are and what we do. And so we'll kind of kick it off there. As Dan said, feel free at any point to put a question in the chat, raise your hand on Zoom, and happy to answer any questions that you might have. Just a tiny bit about myself. I'm not a born and raised Hamiltonian. Grew up in Sydney, Ohio, and my wife and I moved here with our family in 2009. I'm a family nurse practitioner by training. And so for the first 4 years that I worked here at Primary Health Solutions, I was seeing patients exclusively. And then took over as our chief clinical officer, functioned in that role, moved into the chief operating officer role. And then the first part of July, just took over for Mark Belisario, who had been the CEO, president CEO here for the last 14 years. So that's kind of how I got here, and excited to talk about what we do and how we've grown. So when I first came to Primary Health Solutions in 2009, we had 2 locations, one in Hamilton and one in Milton. And we serviced about 6,000 patients. So we're what's called a federally qualified health center, or FQHC. You might hear people, shorten it to the acronym FQHC. We were the first FQHC in Butler County and still the only one based out of Butler County. And the primary mission of that program is to help provide comprehensive access to quality healthcare for primarily underserved communities. And so that's the mission of the organization. You can see here the tagline, where health and healing come together. When I came in 2009, all we did was medical. And we have now expanded our services to include a lot more. And we'll kind of get to that in a moment. Our mission is to improve community wellness through access to quality, affordable, integrated primary health care. And we'll talk a little bit about the fact that it's integrated is really, really important. When we're talking about, especially the patient population that we're called to serve, and we are focused on serving, making it integrated is really important. Our vision statement is to be the future of integrated primary health care. You can see that our core values are being patient-centered, doing things with excellence, respect, and always doing it through the lens of compassion. So some of the services that we provide, we have grown from those days of 6,000 patients in just medical services to, we now have, as of yesterday, 246 employees. We have about 40,000 patients. Last year, we did 115,000 patient encounters. You can see with what's on the screen here, the breadth of services that we provide are now much more vast. So we have family physicians and family nurse practitioners. We are the largest dental provider in Butler County. Women's health, we deliver a third of all the babies at Kettering Health Hamilton. We have express care locations that are open till 9 o'clock, 4 nights a week, so that patients and community members have an option, and they don't have to go to the ER if it's not emergent, that they can be seen for acute issues. They can get those things addressed and done in a cost-effective manner. We do have 4 school-based health centers. We opened our first one in 2015. Our most recent one we opened in the middle of the pandemic, 2020, up in Trenton in partnership with Edgewood Community Schools. We really put a focus on preventative and well child care. We provide a lot of vaccines for kids and adults as well. We provide integrated behavioral health in the primary care setting. And then we're really growing our care coordination department and that aspect of the services that we provide. I mentioned that we have 40,000 patients. Where we may be a little bit different than a traditional healthcare provider, I said that we really focus on the underserved patient populations. So 75% of our patients, of the 40,000, so roughly 30,000, have Medicaid or some version of managed Medicaid, CareSource, Molina, Buckeye. 10% of our patients have no insurance at all. They're uninsured. And then that other 15% is kind of a split right down the middle between Medicare and commercially insured. Now, as a federally qualified health center, we do not turn anyone away based on their inability to pay. So one differentiator is we are not a free clinic. So there is a nominal fee that we ask patients to pay. That's set. Those numbers are set by our board of directors. One of the things that's unique about a federally qualified health center is our board of directors are have to be, and we love this about them, 51% have to be patients. And so that may look and in fact does function differently than maybe what you would expect from a corporate board. And so as a 501c3 not-for-profit, that really helps us stay very patient-centered and make sure that what we're doing circles back to what's best for the patients, what's best for the communities where we serve. The last thing on this slide that I'll just say is vision care. So as we started opening our school-based health centers starting in 2015, one of the things that became very clear to us is that access to vision care, especially for patients that have Medicaid or maybe are uninsured, can be a challenge. And we heard lots and lots of stories about patients that were maybe being labeled as autistic or ADHD or, just kind of bad kids, for lack of a better term, in some of the schools down in Cincinnati. And as they started rolling out these school-based vision centers, what they found out was that a lot of these kids that had been struggling in school, behavior issues, they just couldn't see. And they did a comprehensive vision exam. They got the kiddos the glasses that they needed. And the trajectory for those students and potentially for those families changed. And so we had talked about, hey, I wonder how long it will be until we have one of those stories here at Primary Health Solutions and in Butler County. And our first vision center was in Fairfield. It was about 2 days in, and we had a young lady who had a lot of challenges coming her way. She had Down syndrome. She had a significant eye vision issue, and English was not her first language. And so she had a lot of challenges. And so we were able, and we actually got a picture with her parents' consent of the first time we were able to put those glasses on this young lady's face, and to see the smile when she could actually see. She had an interpreting machine on an iPad. And as she kind of pulled that away from 2 inches away from her face, started looking over top of the glasses and moving it farther away, the smile just got bigger. And we knew that we had kind of that first real success story. And so that is something that is key to our school-based health centers. And those vision centers are open to all of our patients and anyone in the community that would need to come there. So that is something that's grown over the years as far as some of the services that we provide. In addition to some of those direct services that we provide, doing a lot as far as community engagement, probably about 6 years ago, unfortunately, Ohio was identified as one of the worst, actually the worst state in the United States for infant mortality, children dying before their first birthday. And it was significantly worse amongst African American and Hispanic communities. So as part of the state's response to how do we do better, they identified 10 hotspot areas across Ohio. So if we can think about it, Ohio is the worst out of 50 states, and there was 10 high-risk areas identified with Ohio. Butler County was one of the 10. And so we are the grantee in Butler County for the Women, Infant, and Children program. And so between the Butler County WIC program and Primary Health Solutions kind of medical side on the women's health side, we were some of the co-sponsors for that initiative to really say, how do we get down to what are the root causes for some of this, and how do we do better as a community to help these kids make it not just to their first birthday, but well beyond. And so we've done things like group also build a cohort to where moms, families can talk about, hey, I'm struggling with this. How have you worked through that? And there's lots of data to support that goes a long way. And so in addition to that, we had one of our medical providers that was offering to parents, someone has a young baby, that first well child check at the provider's office, that can be a lot to say, hey, load up the baby, carry all this stuff. We got a lot going on. bring them to the office. So we started offering that first newborn visit in the home. Now, because of the pandemic, we had to stop some of that. We're working on getting that ramp back up. But those are some of the things that we're doing to really help lead in the community on that front. We've worked with the county commissioners and a variety of community leaders to how do we help with some of the homeless populations and not stigmatize folks and really just help meet them where they're at and say, how do we get access to high quality healthcare? How do we help you identify and maybe remove some of those barriers? And so we've done some outreaches, taking medical care to patients, and continue to be around the table talking about how, as a community, we can meet the needs of that population. We've worked with the YW for abused women and some of the challenges that come with that, as well as some human trafficking. We were part of a coalition where, unfortunately, one of the ladies that leads that group shared with us that she's worked with Department of Homeland Security, with the FBI, all over the United States as it relates to human trafficking, getting oftentimes these young women out of the trafficking, helping to break down some of these groups. And she shared with us, she said, some of what we're seeing in Southwest Ohio is worse than some of the metro areas like New York and Chicago and LA, which is really, scary. But knowing that we have a great group of people in the community that are very forward thinking and wanting to help address these things is what's really going to help overcome some of these challenges for these young people. One of the things about an FQHC that I love is, and I apologize, I don't know if everyone else, these slides look as pixelated as it's looking for me, but I apologize for that. One of the things that I love about a federally qualified health center is we are, I like to say we're Switzerland. So oftentimes it can get very competitive in the healthcare space. And you can see here, this is a photo during the height of COVID. A lot of the CEOs from the community hospitals, as well as Mark, our president and CEO at the time, really got together to say, how can we do what's best for the community and show a united front to protect people and do what's right in the community. And so I can tell you that with everyone on this list, we either have or actively collaborating with them on some type of a project. And so that's really a great space to be. I like to say that we try really hard to be innovative and say, what are the barriers for our patients? What are the barriers for some of the health systems? And how can we be a partner and a good partner to make sure that the healthcare for everyone in the community is the best? Because as a chamber, as business leaders, we know that those are some of the indicators from a business
Stephen,
look at. Those are things that are people that are looking to move to a community. They look at that.
Stephen, can you hear me?
Can you hear me?
Yes. I think you're having some bandwidth issues. We
Okay.
can't see your current slide and you're frozen. So I'm going to ask
Okay.
you to turn off your camera until
Yep.
after your PowerPoint's over, and that might fix it.
Okay, let me. All right. Can you hear me better, Dan?
Yes. Now see if your
Okay.
slide will move.
All right, let me get here.
Sorry to interrupt, but you were frozen.
No.
We're still on the community engagement slide.
Got it. All right. Are you seeing it move?
No.
Okay. Some of these next things I can probably just talk through and then really get to the 340B topics.
Okay.
So, as far as, locations, we have 2 locations or actually 3 locations in Hamilton. We have a location out in Oxford, Fairfield. We actually, during COVID, we opened a couple sites up in Montgomery County. We have 2 sites in Middletown, Edgewood, and then we have, you may have seen recently in the Journal, we have a mobile dental unit that does a lot of work with other nonprofits, social service agencies to get people access to high quality dental care. We do that in partnership with a lot of the schools, and we're very fortunate to just get a significant investment from the ARPA funds. And so we're looking to refurbish and really relaunch that mobile dental unit in the community. We're excited about that. Let me get here. Okay, so to really talk about the 340B program, one of the things that we pride ourselves on as a business, oftentimes when I'm meeting with other leaders, there are some misconceptions maybe about who we are and what we do. We've talked a little bit this morning about the business itself, but when you hear a term like federally qualified health center, I get lots of questions like, so are you federal employees? Do you get federal benefits? Things like that. So we are a 501c3. We're one of the largest not-for-profits in Hamilton, and we are not federal employees, and unfortunately, we don't get federal benefits. There are some things that with our designation that we do get access to. We do get a federal grant every year. It's called a 330 grant. And so we're approaching a $40 million budget as a system. And about 8% of our funds come from the 330 grant. It's a competitive grant that every 3 years you have to submit an application, show that we're making a significant impact in the community. And then if we're doing a really good job, we will get that grant reapproved. We just submitted ours last week, actually, for the next 3 years. So if we think about $40 million budget, 8% comes from the form of federal grants. How do we support the agency? How do we support the 246 employees? How do we support the 40,000 patients? Most of it comes through seeing patients and patient service revenue. So we bill Medicaid, we bill commercial insurance, we bill Medicare. The grants primarily there to help offset the cost of seeing the uninsured patients and being able to have a low cost, high quality option for them to come to. The other source of revenue outside of some community grants that we're always, trying for when they present themselves is a program called 340B. And so that's what I really wanted to talk about. If you'd have asked me a year ago to give this presentation, I would have said with high level of confidence, no one on the call is going to have ever heard of 340B. Starting about 2 years ago, there's been a little bit more coverage of the 340B program. I got a text pretty early Sunday morning saying, timely, because somebody knew what I was going to be presenting on today, there was a front page New York Times article on 340B. And so a lot of people at this point that maybe aren't in the healthcare industry are hearing a little bit about 340B. So what my goal for the next 15 minutes or so is to talk a little bit about the program and how it benefits Hamilton and the surrounding communities where we're at. So it has grown. When I took over a leadership role here in 2013, literally the only way that we were using 340B was for uninsured patients to get low cost, affordable medications. And that's part of the design of the program. It started in 1992 as part of the National Health Safety Act, and has grown out of that. It is actually now the second largest way that people in America get access to affordable medications, behind Medicare Part B. And so that program has grown. One of the things to know about the 340B program is not only does it provide access to low cost, affordable medications for underserved communities, it also allows scarce resources to come back into organizations such as ours to help grow and further expand services for the communities where we serve. So on this slide, you can see 340B savings is what they call it. 340B savings now make up about 25% of our revenue as an organization. It is almost 3 times larger than the federal grant that we get every year. 340B savings are fed entirely from the pharmaceutical companies, the manufacturers. There's no federal dollars and there's no taxpayer money that goes into this program. And then we use that to support things that are really aligned with the mission and the vision of the organization that may not break even. So for example, a big one for us where the majority of our 340B savings come from and then are put back into our school-based health centers. Our school-based health centers are critical for the improved health of our community. It's also something that we get grants and work really hard with the schools and with outside funders to get funds to start the school-based health centers. To make those sustainable, we sustain those financially with the 340B savings. So starting in 2020, there were some of the drug manufacturers that started saying, hey, if you partner with community pharmacies in what's called a contract pharmacy arrangement, we're no longer going to allow you to access those low-cost medications as a federally qualified health center. There are other what they call covered entities as well, critical access hospitals, what they call disproportionate share hospitals. So this is very open oversimplifying, but how the program works is you have to be an eligible covered entity, which Primary Health Solutions is. One of our providers has to write a qualified prescription for one of our patients, and they have to go to a approved pharmacy. So prior to 2020, that could be a contract pharmacy. So we had contracts in place with many of the retail pharmacies, Walmart, Walgreens, Kroger, Meijer. We tried to make it as broad as possible for our patients. Our biggest partner was Community First Pharmacy. And it worked perfectly because in most of our locations, they were co-located. Downtown Hamilton, up in our Middletown location, they expanded there. And then when we opened our office up in Dayton, they expanded to Dayton with us as a great partner. In 2020, as the manufacturers started making some of these changes and started blocking them, it really started to create a barrier for our patients, and it started to create a financial cliff for us as Primary Health Solutions. So to give a couple of examples and just kind of clarify on how that savings comes for our uninsured patients, so about 10,000 patients, if they came and saw me and I wrote them a prescription for insulin and they went to one of our contract pharmacies prior to 2020, normally that vial of insulin, if I wrote it for anyone on this call that wasn't a patient of Primary Health Solutions and didn't meet some of the income criteria of the program, it would cost $400 for that vial of insulin. There's been a lot of talk in the media and in DC about how do we get affordable insulin to patients. For our patients with that 340B program, they can get that. We literally have access to get that same vial of insulin for about a penny. There's normally a dispensing fee that the pharmacy charges, but to say to a medically underserved patient that has limited financial means, you can get your vial of insulin for the month for $25.01 versus $400, oftentimes makes a significant difference in whether they can get the meds that they need versus not. So that was one part of the program that started to get whittled away starting in 2020. Those patients could no longer go to any of our contract pharmacies if it was one of those blocked manufacturers and get access to that 340B pricing. So they could still go to Walgreens, they could still go to Kroger, they could still go to Community First, and no fault to any of those pharmacies, they could just not sell it at that price based on what the manufacturers were doing. So those patients were having to pay the $400 for the insulin. So The other piece to that is how the other part of the program works. It really helps us reinvest in our school-based health centers and some of the other things that we do in the community. Is if a payer, if an insurance, so be that Medicaid or Anthem or Aetna, if they have an agreement that says we'll pay $400 for that insulin and we can provide it for the patient at a penny after we pay the pharmacy and some of those folks, we get to keep the difference. And then we have to show every year to that program how we're reinvesting that money into the community. And so some of that is, for us, the primary thing is school-based health centers. There are other federally qualified health centers that's how they pay for buildings, to say we're expanding access, or we're paying for, we have a dual boarded psychiatrist in the community that we wouldn't be able to do that without the 340B savings. And so there's lots of ways that we're investing in our patients and in the community that wouldn't be able to happen if it wasn't for this program. And so you can see on this slide, the manufacturers have started doing that. So as a trade organization, we're really working hard with the folks in Columbus. A lot of this is federal. So the folks in DC, and really working to get the manufacturers to start participating in the program like it was written. One of the things that I love about the federally qualified health centers, as well as the 340B program, it has broad bipartisan support. So locally, whether we're meeting with Zach or somebody from Congressman Davidson's office, or whether we're meeting with Senator Brown or Senator Portman, like, they understand the importance of FQHCs. They understand the importance of the 340B program and why it really helps us meet the needs of some of the most underserved and most at-risk communities. One of the groups that really doesn't like the 340B program is the big pharmaceutical companies. So you can see in 2021, there was a total of almost $70 million spent by those groups to say, hey, we think there's some abuse to these programs, and that's why we're going to start blocking some of these arrangements. One of the things that those groups have been okay with, and you can see here, some of the pharmacy benefit managers or PBMs also are trying to encroach on the 340B program. So you can see here, this is nationally, federally qualified health centers take care of over 30 million patients. And as a whole, we really invest in, we talked a little bit about the impact on insulin, getting patients access to insulin. We talk about a lot of programs. How do patients, SDOH is a medical acronym that means social determinants of health. There are a lot of our patients that we can do really good work in the exam room. We can get them access to all the services we've talked about. But if I've got a diabetic patient that is staying in one of the homeless shelters here in town, getting food out of a food pantry, how do we keep their diabetes under control and keep them from having to go to one of the emergency departments and really driving up the cost of healthcare if they can't get access to good food? And so looking at food deserts, and there are FQHCs that are doing things like what we would call a prescriptive food program, to where we can work with our physicians and dietitians and really say, how do we get food potentially delivered to the patient's home or wherever they're staying? These programs called Food is Medicine, those are things that we would love to invest in. And we would be able to do that with the 340B program savings that come back in. And so you can see how this is making a difference and making an impact across the US, but definitely here at home, here in Butler County. One thing to note, you can see that's a lot of numbers, and this is why it's caught some attention of folks. Again, this is not federal dollars that are tax dollars that are spent on the program, but they are, like, if someone has Medicaid or Medicare, they are paying for the medications. And so that's $44 billion that gets reinvested. The one thing that we're trying to advocate for is, you can see about halfway down the slide, the consolidated health center programs, that is federally qualified health centers. So some of the talk that's going on in Washington and Columbus, we're trying to say, hey, we make up 5% of the total spend. We kind of feel like we're getting caught in some of the fight between the drug manufacturers and the hospitals above that top half of the slide, which is 87% of the spend. We work really closely with our hospitals, and we don't want anything to happen to their 340B as well. But this is one time where we're really kind of focused on, we're 5% of the program, and we have to have those funds to continue to sustain the program. And so that's part of the conversation that we're having with health policymakers and advocating for in the community. So the last slide that I want to show here, and then really want to open it up for questions for the group, is we were just over in Columbus last week, and one of the national policy leaders for federally qualified health centers shared that if you look here, they did a survey of FQHC CEOs and said, if the 340B program went away, what percentage of your patients would go without necessary medication if they couldn't get it through a 340B pharmacy? You can see here that it's a significant number. 88% believe that over 10% of their patients would lose access to critical medications. And so we've talked for maybe 15 minutes here of, okay, this is a significant program federally and here in Butler County. What are we going to do to make sure that those funds are still coming to an organization like ours so that we can reinvest in underserved communities? So one of the things, and if you've not heard about it already, you're going to hear about it over the next weeks and months to come. Primary Health Solutions is opening our own pharmacy. And so that's one of the ways we've talked about these manufacturer blocks. The only agreement that they will allow us to restore access to those low-cost medications for our uninsured patients and ensure that those savings are coming back for us to reinvest in the community is by us owning the pharmacies. About half of all the community health centers in Ohio have moved to that over the last 2 years, and the other half are actively planning how to start their own pharmacy. So the biggest implication for that and what that's going to, you kind of see in the community, we have a long partnership with Community First Pharmacy, and they have been an exceptional partner. These changes have nothing to do with them not doing anything right. They've been a great partner, but because of what we've talked about today, we were just at a spot where we had to make a change. We're also changing some of our other contract pharmacies to be able to move those patients, if they want, to PHS pharmacy. Patients always have choice, but we're trying to provide some things that would make it, for our underserved patients, transportation is a big barrier. So we hear from patients pretty consistently, it's great that I can get low-cost medications, but I don't have money to pay for gas to get to the pharmacy. So middle of August, we opened the first PHS pharmacy up in Middletown at our Verity location. And next week, we will open the second Primary Health Solutions pharmacy location on 2nd Street here in downtown Hamilton. Out of both of those locations, they will serve as a central fill pharmacy. So our patients could walk in and get their scripts filled like anyone has in the past. Now, one note, where it will operate a little bit differently than what Community First Pharmacy has done in the past. Community First has operated as a full retail pharmacy. Anyone could walk in and get their scripts filled there. Initially here, it will only be open to our patients, Primary Health Solutions patients. And that is so that our patients, we can work through that. At some point, we may do full retail, so anyone in the community could come. And people always have the option to say, hey, if this is a big driver for me, maybe I should look at Primary Health Solutions as a place to get care. But initially, it's going to be what's called a closed door pharmacy. And as Community First opens up another retail location, if folks previously were there, we're going to work collaboratively with them to get patient scripts transferred there if that's something that they want. We've worked out a great continued relationship with Community First, and we look forward to that continuing in the future. But for our patients, to remove some of those barriers, we will do delivery, so mail order, as well as same-day courier service. We can do, even if they have something like insulin or something that needs refrigerated, Monday through Thursday, we can do those courier deliveries. We probably won't do that a lot on Friday, just in case someone is not home. We don't want a refrigerated medication sitting on a front porch Friday, Saturday, Sunday, and then something happening to the medication. So that is something that's happening. We're excited about that. What that did on August 13th when we opened, any of our patients, whether they're in Oxford or Montgomery County, any of the outlying locations, they can get it filled at one of those two locations and then delivered to their home. It instantly restored all of those savings for all of those patients. So patients that we've already started to hear stories of patients saying, I was previously getting this medication. It started getting blocked by the manufacturers. I was paying $350 a month for that medication so my child could go to school and be successful. I was paying $400 a month so that my diabetes wasn't sending me to the hospital twice a month. It's those stories that really drove a lot of the change by making that move. So you'll start seeing, I think in the next couple of weeks, there's going to be a sign going up in downtown Hamilton on the pharmacy there. There are going to be some things that you see about Primary Health Solutions Pharmacy, but I wanted to talk a little bit just to help business leaders in the community know, okay, why is Primary Health Solutions doing a pharmacy? What prompted that? And what can I tell people in the community about that? So with that, are there questions that I can answer?
Well, of course, I have questions, Stephen.
Absolutely.
Pretty exciting news. I think I'm trying to grasp exactly, what this means. But my question is, sometimes the availability of programs are offered to an individual because of, how they qualify. And sometimes it's to a whole community. So is the SB 40, is that individual, or does that, because of Hamilton's position, does that open it to a broader audience in Hamilton that wouldn't maybe normally qualify individually?
Yeah, great question. So it's based off of, as I said, you would have to be a Primary Health Solutions patient, but then there's also some financial metrics there. Okay. And so if someone is a patient here, because we're happy to see anyone, we talked about the demographics of what our patient base looks like, but anyone could be a patient here if they wanted. That being said, if somebody has commercial insurance, they come here and they're making significantly over the federal poverty level, what the 340B cost for them would look like is probably going to be very comparable to what they would pay retail at any other pharmacy. 98% of our patients were at or below 200% of the federal poverty level. And so for, ours is on a sliding fee scale. So for our patients that are at 100% of the federal poverty level or below, and they're uninsured, there is no dispense fee. And so literally, if someone needs that insulin and that's where they fall on the sliding fee scale, they would get that vial of insulin for 1 cent. And that's part of how we're reinvesting that money back into the community. There's been a lot of conversation about getting low cost insulin to the community. We have taken away all, dispensing fees and all of that for insulin and any medication if they qualify on those financial requirements.
Okay, and thank you. And I also see here, Elizabeth said she loves the idea of the mobile dental care. Where can they find the schedule for that?
Yeah, so probably for the next few months, there won't be a schedule just because it's going to be over in Mason getting completely overhauled. As we get closer to relaunching the mobile dental unit, you will see a lot on our website and on social media about where that's going to be at. There's also a way where organizations can connect with us to request, hey, can you bring the mobile dental unit out? We've done that in partnership with Dr. Moss and Genesis. We've done that in partnership with some of the health systems. We've done that with, a lot of community-minded organizations, faith-based organizations, to really just expand access to those communities. So I would welcome, I don't think I put it here, but I'm happy to provide to the group my contact information. So moving forward, reach out and say, hey, we would love to have the mobile dental unit at our organization, and we can work on getting that set up.
Stephen, I could also say, since you guys are on the Explore Hamilton app, I would think that at some point you'll have a schedule posted on your website or something, so people could also look at the Explore Hamilton app and look at the website to find what that schedule is going to be when it's back on the road.
That's exactly right.
And then I have another question. The
Yes.
SB40 program or B40 program, does it include like third tier drugs for, very expensive medications for, long lasting critical illnesses?
Yes. So now there are some, and we're working through this now, there are some of those type medications, Dan, that have to go through what's called a specialty pharmacy.
Right.
And so we're actually working with our pharmacy management company to explore the possibility of becoming a specialty pharmacy as well. And so that, again, patients wouldn't have to go outside the community or really have to go multiple spots to get the meds that they need. So part of the program is, the idea is to remove barriers for patients. So even if someone has insurance, if there's a point, if it's cheap, and so if it's cheaper for them to pay cash for the 340B price, if they qualify, absolutely, we would run it. And our pharmacists and techs are trained to look to see what is the lowest cost for the patients if they qualify. And if it's cheaper to not run it through insurance and just pay cash versus the copay of running it through insurance, that's how we would do it every time.
Cool. Any other questions for Stephen? Laura, do we have anything from Facebook Live?
Nope, nothing on Facebook Live today.
Stephen, I did want to interrupt you again, but your PowerPoint froze, so we didn't get to see any of your slides except the first one. So I'm going to ask you to forward those to us.
I will.
If you would, and then we could always send them out to the people who were in attendance today, or do a link when we post it on YouTube, so that people can see the slides that were not visible during the presentation.
Absolutely.
Any other questions? Thank you very much, everyone. This has been terrific information. There he is. And, I'm fascinated. I don't think people realize about your school-based clinics either. You could probably spend an entire presentation on each one of the things you guys are doing. So we may bring Stephen back again in the future. So this has been great. I hope everybody's enjoyed it. I know a lot about what you're doing, but every time I hear you guys speak, I learn something. So in a couple of weeks, on October 11th, we have our next Coffee and Conversations, and we're going to have Christopher Owens from Taylor Oswald. And they are a risk management company. So he is going to be talking about managing your risk with your company and how simple decisions you make or don't make could actually cause you to lose your company. So you want to tune in to that with Christopher from Taylor Oswald. So with that being said, I think we're done. Thank you again, Stephen. Thank you all for joining us today, and have a great day, everyone.